Hello, my name is Dr. Nimsing Ladep. I'm going to speak about three aspects of questions I commonly get from patients whenever they're asking me on the social media regarding hepatitis. And in particular, let's face one hepatitis at a time. And the most common we know is hepatitis B. I'm a consultant in hepatology, and I see patients with liver diseases, and I've managed quite a number of many of them. I've also worked in the prevention of liver cancer and fibrosis in Africa, a group that did some work in three nations. And so that's just much about me. But let's jump into the issues. There are three things that patients who have hepatitis B are often very worried about. First of all, they are told the diagnosis without uh, any clear discussions, and so they're worried about what the outcome might be. Secondly, they also have questions about whether perhaps a perfect cure, and they demand answers, which is rightly so. And then, thirdly, they want to know, is there a cure? Is this going to kill me? And so on and so forth. And also, they get very enraged and confused when they're told that there is no treatment available, or the treatment doesn't lead to cure, or there is also the very big challenge about the fact that although they have a positive hepatitis B surface antigen, they do not qualify for treatment. And so that really can be very confusing. I'll attempt to try to answer these for you. Please bear with me as I go through this in a little bit more detail. It's going to just be for about 4 minutes or 5 minutes, and so you will be done. And just stay with me a bit, and we'll go about that. Now, by the way, I've got quite a big number of people that I tend to see and also even chat with me, and they want to know, and even some of them have had consultations with me, and quite interestingly, I'm happy to reply you if you send me messages, and I will be just bear with me if I cannot get to you on time, because I get tons of messages that come to me. Now let's jump to the question. Hepatitis B is infection by a virus known as hepatitis B virus, and it's inflammation of the liver. So hepatitis, hepatic refers to the liver, itis refers to inflammation. Now, what happens is that the majority of people who have this infection are living in Africa, and most of them have acquired the infection when they were very small, and so they don't even know how they got it. Although it is known that sexual route is a non-transmission route, this is not the most common. I do know that there are people who have actually become very, very sore in their relationships when they discover that one of their partners had hepatitis B, and they thought that they were being unfaithful. No, don't do that. A lot of people in Africa do not know how they got the infection. Most of them, while playing with their mates, and or perhaps may have even acquired it from their mothers when they were in the womb. And so lots of them don't know. And that's the one that actually has a tendency to be carried on for life. And so most times they are diagnosed, they have had it for a long, long time. And so people get worried. Oh, why am I having this now, at this moment? It's going to kill me, it's going to kill me. Now, obviously, it does kill through two mechanisms. When the liver has become cirrhotic, meaning that it's become a bit fibrotic and not able to function well, and or a liver cancer develops. This does develop, but we don't know how long it takes in each person. On average, it's been known to be about 25 years, 15 to 25 years. But since we don't know when most people have had the infection, we've seen 17-year-olds have liver cancers and then 90-year-olds as well. And so it's quite a challenge to know and dictate when that would be. Now, the treatment is dependent on some factors, and that is if you are multiplying the virus in your system, that's when the treatment becomes important because the drug works on a substrate, that is, works on an enzyme, and that enzyme is responsible for multiplying the virus. And if that enzyme is not active, then it means that taking the drug is just like pouring some kind of stuff into a waste basket. It goes away without any action. And so you don't want to do that. And so the criteria requires those. But there are some people who, even if they don't have the virus actively in their system, for example, those who have cirrhosis, in other words, the liver has become scarred, and or if they have a kind of a measure known as hepatitis B E antigen, which is a marker of replication. In other words, if you're living in a place where you do not have facilities to do the viral load, and which we know, by the way, is expensive, then it becomes important that you rely on the HBe antigen, which, if present, the WHO has agreed that it can be used as evidence of replication of the virus, and which means that you are qualified for treatment. I think I'm giving too much at this point. I will have to look at the other component dealing with the questions about cure and or the herbal treatment in a later video. And I hope you will stay with me and be here to just understand how we go about managing hepatitis and many other diseases that we will come across in our forum. Thank you very much, and please like this video, share this video, and support and help people who are genuinely in need of understanding so that they're able to cope with this disease. Thank you very much. Bye-bye.